And I am from New York, in a position. My question really has to do with healthcare reform.
Yes.
Politics is the art of the possible. Sometimes in doing the possible, you sacrifice principle. Where are you going to draw the line in terms of what has to be in? I've heard that we're going to give up universality because that may not be possible, or we're going to give up the public option because that may not be possible. Where's the line on it?
Look, the President is very clear that he wants a health reform that will reduce costs for people who have health care and make it possible that those who don't have coverage, and that is a principle that we are not willing to abridge. He believes strongly that a public option is an important part of that mix. There have been some back and forth about various funding mechanisms. He's put a big down payment on the table, in part by challenging some obvious distortions in the system, like the subsidy for the managed care companies in the Medicare Advantage program that have no place in this legislation. They're a tribute to the power of lobbyists, not to the interests of the country. So he's done that, and we're going to move forward. But what we're not going to do is make the mistake of handing a fait accompli to Congress and saying, here's how we're going to do it, our way or the highway, because that's not how you get things done. And so we think we have a great environment to move forward on health reform. Unlike 1993, the confluence of interests who are coming together for health care reform are really breathtaking. I mean, whoever thought that the Chamber of Commerce would be advertising for health care reform right now? The insurance industry is talking about health care reform. We have an environment in which, because of the crushing cost on businesses, families, and the government, everyone now recognizes that we have to do something, and we need to take advantage of this moment. And so we'll hold fast to our principles, but we're willing to negotiate about how we achieve them.